Why are a lot of women giving birth these days by operation through cesarean section? These questions have kept coming up. You know, each time you bring up this discussion in the village, in the quarter, you know, people will always say, why are so many women delivering now by operation in the hospital? Why is it that doctors are only doing operation every day? They're operating the women to carry the babies. And they begin to have several impressions. Some of them being like, you just want to make money, since doing an operation is it costs money. No more than a fee for normal delivery. Those who get to the labor room, do labor and give birth, they may spend hours or spend a whole night, and you the midwife or the doctor, the nurse, you spend sleepless night, but you may end up having less than 10,000 francs CFA as delivery fee. And some people will say the operation will be costing 100,000, 150, and in some private hospitals even more. You know, it gives impressions that they operate to make money. No, I want to disprove that. My name is Dr. David Ayim. I am in Bamenda, Cameroon. I am your reproductive health expert, and of course I hold a PhD in public health. I have chosen that we will be doing the education of the public, be them health personnel or lay persons in a community. There are certain issues about health, especially relating to reproductive health, that we need to share, okay? That there are ideas we need to really discuss them for people to understand. Now, why is the rate of operation high? My dear brother, one first reason is that we must do everything to reduce maternal mortality, the rate at which mothers or women die, okay, in the course of giving birth or from causes relating to pregnancy and childbearing. You know, sometimes in the days before, like people keep comparing, women were delivering before without operation, and then it was going safely. No, you didn't take good note. The rate of maternal mortality used to be very high, and even World Health Organization, took it as a serious public health problem, and then started putting strategies and policies in place to see how to curb, to reduce the rate at which women die in the process of giving birth. A lot of women used to die. A lot of the babies used to die in the womb and during delivery or shortly after delivery, meaning that we had also neonatal, that is death of the newborns. We had also a death of the mother at all levels, during pregnancy, during labor, and even within the puerperum, that is up to about 6 weeks or slightly more after delivery. Now that is what they call maternal death. The rate used to be very high. One of the strategies was to train medical doctors, to train medical personnel, so that they are capable to do operations when the life of the woman during labor is in danger. They better operate her so that they can save the mother and save the baby. Sometimes the reasons could be that the womb is not contracting well, and they may give drugs that could increase the contraction and it still fail. They have to operate the woman. If the baby starts having what they call fetal distress inside the womb, any further delay, the baby will die. So when they operate it, they save the life of the baby. When you go to the passage, the pelvis, human pelvis down here may be contracted. A human pelvis that is contracted, baby finds it difficult to go through it, and it may come and hook inside. If they don't operate that woman fast, the baby may die, and even the woman may be at risk. Are we understanding? The cervix may not be dilating. It may be that thick, hard type. A well-trained personnel will determine that. If not, when baby start getting into distress because of continuous contractions and the root is not opening, we are still forced to do a cesarean section and free the mother and the baby. Now, even another cause of or reason or indication for CS is Still about the passage. When there is what we call cephalopelvic disproportion, meaning that the baby may be bigger than the passage, and the progress of labor is not going to go smoothly. They are only going to end up operating the woman to save her life and save that of her baby. If you go down to the passengers now involve the baby in the womb, right to the placenta. As we said, baby may be bigger, what we call macrosomic baby. That is weighing 4 kilograms or more and may now not be able to pass through the passageway. The earlier I discover that, the better. They prepare her and operate her to save the life of the mother and that of the baby. Else, they are in danger. The baby may be lying across, like transverse lie. There may be what you call malpresentation, malpositioning. This will delay the progress of labor, putting the life of the baby inside that womb to jeopardy. And if the personnel are not well trained, that baby could die. They will say, oh, the woman has given birth, but the baby came out and could not cry. They will be hearing of stillbirths. No. The strategies to even operate more, once the indications present themselves, is a way to save the life of the mother and the baby. Nobody dies because they put knife on you. No, there might be, except there's another problem. If you go now even to the state of health, the state of mind, the psyche of the woman, it may also be a problem. That a woman is there in labor, doesn't have any energy, it cannot push, and they try every way, it cannot, there is no maternal effort. Oh, they may even have to induce the labor. Maybe in case of post maturity or post-term, and they may induce labor and the induction fail. When induction fails, we are forced to do a cesarean section to save the baby and the mother. Are we there? Now, the problem could also be coming from, unforeseen situations where there is just no progress of labor and no one is finding a direct cause or direct reason. And then there is need that they can operate that woman. Don't forget, there are other conditions like what we call abruptio placentae, where the placenta begin to separate before time, and then they are forced to operate the woman and save the baby and save the mother. They might what we call placenta previa, where placenta is coming before the baby and may block the passage for baby to pass. There might also be rupture of the uterus. There are several reasons, my dear brothers. Let the doctors do their job. They are well trained. You can entrust your sister, you can entrust your wife, you can entrust your women in the hands of well-trained personnel in the hospitals. Then they are the ones who will make sure your woman delivers and be safe, and the babies safe. All of that, reducing the rate of maternal death, reducing the rate of infant or neonatal death, so that our communities can be safe. Please like and share this video. Make your positive comments. Even if they are negative, make them, because they will edify us and we keep doing more research to discuss with you. You can ask questions, okay? But you can still write to me, on WhatsApp. The numbers 694 35 3141. If you are not in Cameroon, always start with +237 before you add that number. Then you leave a voicemail or a message. Do not call. Thank you. Thank you. Bye-bye.